In as far as medications are concerned, typical selective serotonin reuptake inhibitors, or SSRIs, have also generally proven to be ineffective for misophonia sufferers. I personally have been prescribed many of them, specifically for OCD, and given to me for my misophonia, the results being quite dismal. At any rate, however, once a medication or even an SSRI comes out, specifically for misophonia, I suppose I'll have to try it. Recently, I have read testimony from misophonia sufferers, which I cannot name, regarding treatment with an interesting technique known as neurofeedback, a procedure in which an electrode is placed on a person's head, and using a computer and software, the person learns to alter their own brainwave patterns by interacting with stimuli on a monitor. The therapist can view how the brain is firing on his or her own screen and adjust the electrode or program accordingly. This idea is that the brain is rewarded for thinking correctly and adjusts itself as it receives audio and visual feedback. This technique is also has reputable success in treating a variety of disorders, most commonly ADHD and anxiety disorders, such as OCD. For ADHD, the treatment teaches the person to maintain focus, and for OCD, it teaches the person to shut off the area of the mind that is obsessing. One testimony involved a man who had misophonia for over 30 years on top of some OCD symptoms of compulsivity and repetitive actions. This man and his son, who had also displayed such issues, had proclaimed that there had been remarkable reductions in all of their OCD symptoms, as well as a tremendous relief from misophonia, alongside a few others who also received this treatment. And unlike schema reconditioning psychotherapy, which I've also heard of, neurofeedback is becoming a hot topic in misophonia and learning disability. Regardless of whether or not misophonia is a type of OCD or standing alone as a separate auditory or sensory processing disorder, it certainly bears enough resemblance to and even comes paired with OCD and learning disability enough that the coincidences are pretty interesting. Even considering that misophonia were to technically be classified as a sensory disorder, it's quite common for those suffering from OCD or learning disability, which commonly occur together, by the way, to display sensory abnormalities and misophonia-like symptoms. I, of course, encourage open discussion on this issue, and if I've missed something that you think is important or misrepresented something, please feel free to comment.